Okay, so we have Mrs. Ford. She's a 32-year-old female. She was admitted to the ICU with neuro 2 days ago after a fall. She has a large epidural hematoma on the left parietal lobe. She is intubated. They did this to protect her airway because she has low levels of consciousness. She has an EVD placed. She also has an OG tube and is getting a Foley today. I placed the Foley of 14 French. She tolerated well. She did have urine coming out for the first 3 hours. Her urine output was 180, 240, and 440. Her vital signs were 124/68. Heart rate was 84. Respirations is 16 with her ventilator. Her intracranial pressure is 12. She's not on any type of sedation. She's not opening her eyes other than with a touch, but she goes to go ahead right back and close her eyes. She's withdrawing with some pain. She did get prescribed normal saline 75 milliliters per hour. I did initiate that, and she's also getting a tube feed 40 milliliters per hour. She has to go ahead and get switched over to D5W as well with her IV fluids. Her lab values that we took were sodium, serum, osmolality, and urine specific gravity. Her sodium was 155, her serum was 310, and her urine was 1.005. She is excreting a lot of water with her urine, so we expected those results. The provider is ordering free water flush of the OG, 200 milliliters every 4 hours, changed to D5W, 125 milliliters per hour. A DDVAP to IV push every 12 hours. We want to do a daily weight on her. Check her sodium and serum every 4 hours. We want to make sure that we're setting the feeding tube to administer free water and change IV fluids. She has been doing well for the past 2 days of treatment. She's now back to normal on her baselines of her urine output and specific gravity, but she is continuing to have GCS between 4 and 6, and her left pupil is now fixed in at 8 milliliters. 8 mm. The nurse notes showed that her respiratory rate is erratic and her intracranial pressure has rose to 18. Her heart rate is dropping. The doctor looked into it. It looks like her hematoma is burst and she's causing some swelling, but her bleed is starting to be more pronounced. For now, they're just keeping her on watch. She has not gotten up for me, and she's not talking, so she's just kind of laying in there as of now.